You're listening to Health Coach Conversations, a podcast where our conversations help health coaches all around the world to level up our businesses and to get more clients. Hello and welcome. This is Cathy Sakura with Health Coach Conversations in the Health Coach Group. I am visiting today with Dr. David Katz. Dr. Katz is a board-certified specialist in preventative medicine, public health. He is the founding director of Yale University's Yale Griffin Prevention Research Center, past president of the American College of Lifestyle Medicine, and founder president of the True Health Initiative. Dr. Katz earned his BA degree from Dartmouth College, his MD from the Albert Einstein College of Medicine, and his MPH from the Yale University School of Public Health. The recipient of many awards for his contributions to public health, he has received 3 honorary doctorates. He has authored roughly 200 peer-reviewed publications, hundreds of health columns, and 19 books, including leading textbooks in both nutrition and preventative medicine. Katz is recognized globally for expertise in nutrition, lifestyle medicine, and health promotion. Called the Poet Laureate of Health Promotion by his peers, Katz has given keynote addresses in dozens of countries on 6 continents and in all 50 U.S. states. Today, we're going to talk about diet as a vital sign, how coaches can optimize clients' health and longevity. So let's start out with, can you tell us a little bit about your career path and how you ended up in an entrepreneurial role? You're not working in an office as an MD now, right?
I'm not seeing patients anymore. I did for 30 years. So I am in an office. It's my home office, but I'm not, if by office you mean a clinical practice, not anymore. So my career path began with training in internal medicine right after medical school. And it was great. It was a real privilege to learn how to take care of people with acute illnesses, to be basically empowered to deal with the great urgencies that one experiences in clinical care. But I'm a big picture person. I think really what set in motion the overall course of my career was just that tendency to see the forest and not have the view obscured by the trees. So all those sick people in hospital beds were the trees, and we were learning how to tend to them. But I had the distinct impression that, in essence, I was learning how to be one of the king's horses and one of the king's men, because hospital beds were overwhelmingly filled with people who had all kinds of horrible stuff that we couldn't reverse. We could patch them up. We could maybe defer death for a while, but we were in almost no instance restoring intact vitality. So, once Humpty Dumpty topples off that wall, we just don't have the wherewithal to unscramble an egg. And I thought that's what I'm being taught how to do, patch up these cracked eggs. And it doesn't really make sense. There ought to be a seatbelt on the wall, or cushions at the base of the wall, or a fall prevention program, or something. So I wasn't satisfied, and I thought, I need to be involved in the effort to prevent the next cohort of people becoming this ill with stuff that never needed to happen: heart disease, cancer, stroke, diabetes, dementia, lung disease, etc. So shopped the options, which were not entirely clear at that time, but ultimately settled on preventive medicine. Did my residency at Yale, so second residency in preventive medicine, public health, focused on chronic disease prevention, and especially leveraging the power of lifestyle, diet, and lifestyle to prevent chronic disease. But the answer to your question about why leaving, so I was at Yale for the better part of 30 years. I was a clinician for 30 years. I've been many things over the course of my career, and it's not because I have problems with my attention span, but because very early in my life, I was impressed with a quote by Gertrude Stein: "A difference to be a difference must make a difference." And what I committed myself to, Cathy, in my professional endeavors was adding years to lives, adding life to years, playing a role in reducing the burden of obesity and preventable chronic disease. And here we are almost 30 years later, and the global toll of obesity is worse, not better. The global toll of chronic disease is worse, not better. Life expectancy in the United States has actually gone backwards, partly due to the opioid epidemic and partly due to COVID, but still the overall trend isn't great. So we're not winning the war. When you're not winning the war, you can keep fighting it the same way and just lose it, or you can say, can I do something different? Can I do something better? And there were new opportunities in the realm of private sector entrepreneurial efforts. And I basically just followed wherever I thought I had the chance to make the biggest difference. And here I am, accidentally an entrepreneur.
Isn't that funny how that happens for entrepreneurs? How is diet a vital sign?
Well, diet isn't a vital sign, but our contention, mine personally, my career-long mission, and now with the advent of what we can do at Diet ID, our professional position as a company is it ought to be. So, what are vital signs? First of all, they're vital because they're critically important information. Why? Because they're powerful predictors of your current health status and your likely health status in the future, near term, long term. So, for example, if your blood pressure is higher than it should be, you are more likely to have heart disease, stroke, eye damage, kidney damage, etc. It's a threat to you now if it's very high. So, if it's seriously out of range, the threat may be immediate. And what we measure as vital signs have a certain amount of predictive power in the near term. Blood pressure very high or very low, heart rate very high or very low, temperature very high or very low. But even small deviations from the desired range have very powerful predictive capability for longer time horizons, the risk of chronic disease down the line. That's what makes them vital. It's not as if this is information that came down on a tablet from God. We just discovered in medicine that this is information that it's vital to know because tolerances are narrow. Blood pressure needs to be within a particular range for people to stay healthy across the lifespan. Well, the single leading predictor variable for premature death from all causes and for incident chronic disease in the United States today is diet quality. Period. Full stop. This was very nicely enumerated, if such an unpleasant topic can be nicely enumerated, in an op-ed in the New York Times, August 26, 2019. The two authors were Darius Mozaffarian, Dean of Nutrition at Tufts, and Dan Glickman, former Secretary of Agriculture of the United States. And they point out that poor diet quality, and we're not talking about hunger or starvation, we're talking about just eating junk where food ought to be, is responsible for over 500,000 premature deaths in the United States every year. That's incredible. And when you think about the COVID pandemic crossing that threshold, that was a big deal. That was a national moment of reflection and mourning. Well, poor diet crosses that threshold every year. And this is something of our own devising. We manufacture this food supply. They cite the primary literature, and in particular, that's the Global Burden of Disease Study, especially a paper published in The Lancet looking at dietary factors and all-cause mortality in 195 countries, which actually goes further than the op-ed and makes the case that poor diet quality is the leading cause of premature death year in, year out in industrialized countries all around the world. And then if you follow the logic, okay, what should we be doing about this? Well, for one thing, we ought to be measuring and managing diet routinely, i.e. treating it like the vital sign that it is. If it is the most potent predictor of mortality and morbidity risk, it is in essence a vital sign, and we ought to be treating it as such. And that's actually a position now formally adopted by the American College of Cardiology. They published a position paper in their flagship journal Circulation in 2020, saying that diet is so fundamentally important in cardiovascular medicine that it ought to be measured in every clinical encounter, if only we had a tool that could do that. Well, of course, at Diet ID, that's exactly what we've invented, developed, deployed, and validated. So we now do have a tool. So our position is it's incredibly important. It's, in fact, the single most important predictor variable in all of modern medicine. And we now have the means to measure it routinely. So it's a new day. And diet should be kept. Diet quality should be included in that standard list of vital signs: temperature, heart rate, blood pressure, respiratory rate, diet quality. It's that important.
How can coaches stay within the scope of practice, but specifically address nutrition issues among their clients?
Well, certainly anybody working on health coaching is going to be talking about diet. It's too big a piece of the equation. And I think one of the nice things that we potentially can offer is a synergy, because we baked into Diet ID an opportunity for the individual to find their own goal diet. And the way that works, the way personalized nutrition really can work today, is you think about two things. First, what is it you want diet to do for you? Do you want to lose weight? Do you want to reduce inflammation? Are you trying to manage type 2 diabetes? Are you trying to prevent or manage hypertension? There is a vast amount of peer-reviewed literature on each of those topics. So our dietitians and our experts, and our expert panel is a literal who's who in the world of nutrition: the current chair of nutrition at Harvard, the former chair of nutrition at Harvard, the inventor of the glycemic index, the editor-in-chief of the Journal of the Academy of Nutrition and Dietetics, and on and on it goes. An amazing group of people. So, people who really know what they're doing helped us develop a framework to sift the weight of evidence and essentially match different types of dietary styles or patterns with health goals. That's step one. Step two, and this is also critically important, is how are you actually willing to eat? And you can think of things like ethnicity. If you are Latin, if you're Mexican American, and those are the foods those are the foods you love, those are the foods you were raised on. If you're Chinese American or Indian American, pick anything you like. Well, it's all well and good that the DASH diet is recommended for high blood pressure, but it may look totally foreign and unappealing. What we're able to do in the Diet ID diet map, because we stratify all the different kinds of diets into 10 tiers of quality using the Healthy Eating Index 2015, is help people identify a way of eating that actually appeals and then optimize within that category. So we use those two filters. What is it you want diet to do, and what way are you actually going to eat? And at that point, the coach is really involved in addressing not so much the what to question, because we've handled that. It's baked into the digital interface, and it has, again, the imprimatur of world-leading experts behind it, and it's predicated entirely on the peer-reviewed literature. The coach does what coaches do so uniquely well, and that is troubleshooting and lending support. And, I'm trying to do this, and I need tips, to manage my time or shopping or recipes, or, I think there's a lot that is probably quite comfortably within the scope of practice of coaches all around the country that is critically important and aligns with what we're able to provide via the digital interface. So, as best we can tell, and I know that there have been some areas of contention between what health coaches can and should do and what, for example, dietitians want health coaches to do. Personally, I think there's a big enough dietary problem in our country that it needs all the attention it can get from, all qualified professionals. That's my personal position, and I've advocated consistently for that. So more involvement with health coaches, for example. But I think we basically built a synergy, a complementarity into this combination of digital assets and human health coaching.
Yeah, there's enough work to go around, isn't there?
For sure. Diet quality in the United States has not improved appreciably for decades. It's gone up a very little bit, but mostly stagnated. So, again, we're not winning the war. And, when I look out at that situation, see diet quality as the leading predictor for mortality, morbidity, the statistics in mortality, morbidity going south rather than north, are heading in the wrong direction. Now is not the time to be fussing about opportunities to bring more qualified person power in as part of the solution. We need all the help we can get. We need to win this war, and so far that's not happening.
Oh. You are talking about the product Diet ID. Is that an app?
Well, we're Diet ID. Yes, in a sense, it's an app. It's a web-based app. It's a company. It's a concept. Essentially, where this all began was with the invention of the first fundamental advance in dietary assessment methods in our lifetime and more. It's been really over 50 years since there's been a whole new way to assess diet. The semi-quantitative food frequency questionnaire is the newest entry, and that goes back decades. With Diet ID, we've completely reverse engineered the whole concept of dietary assessment. If you think about it, when you ask people to try to remember how many times in the past 6 months did you eat broccoli or drink orange juice or have pasta or have peanut butter or eat almonds or, anything you like. And then, okay, so that how often, how much, how were they prepared, what was served with them. Each time you ask that question, you introduce yet another opportunity for error because nobody can remember those details. Nobody. And you could say instead, okay, I'm just going to ask you to remember everything you ate yesterday. People don't do that very well either. Or, okay, I don't trust your memory. I'm going to have you write down everything you eat as you eat it for the next week. Well, time consuming, tedious, labor intensive. The memory based methods are quite inaccurate. And the journaling methods are extremely time intensive. If you're going to journal everything you eat for a week, you have to do it for a week starting today, and then first submit it to be analyzed. So the delay between the start of the work and the answers is over a week. A lot of time for you, a lot of time for the dietitian, usually who's at the other end, who has to analyze it. So we said, the goal of all this, it's extremely cumbersome for all concerned, but the goal is to get a basic representation of that person's total dietary pattern. I don't really care exactly how many florets of broccoli they've had in the past 6 months, but I do care how big a part of their overall diet is stuff like broccoli. That matters to me. Mm-hmm. So what I really want to know is their basic dietary pattern, their overall diet quality, and approximations of nutrient intake and so forth. So why don't we cut to the chase? Why don't we build images that represent all the different kinds of diets that exist in the real world for any given population at all the different tiers of quality? And instead of asking people to badly misremember all the components of the diet, do something instead that humans are really, really good at, and that's pattern recognition. I'm wearing glasses. Those of you looking at the video version of this will note that. Those of you just getting audio, take my word for it. But to get these glasses put between my eyes and you, I had to go to an eye doctor or an optometrist, and to get the prescription just right, you look through something called a phoropter. That's that complicated device where you rest your chin on it and you look at two images of something. And the question to you is very simple. Which of these is more in focus, A or B? And you answer, and then they swap out the lenses and you're seeing two more images. How about now, A or B? I think you probably all played that game. Well, that's how I got these. So I played that game. Incredibly easy. And within about 30 seconds, A or B, A or B, A or B, A or B, I've got an exact match for my eyes in diopters. The physics, the optics baked into the phoropter are really complicated, but for me, it couldn't be simpler. Just pick A or B. We've done that for diet. So essentially, we took all of that difficulty of trying to remember the details of, what was your serving size of this, that, and the other thing, and how often, and how prepared over the past 6 months. Just said, basically, people eat overall dietary patterns. That's what matters most. That's what determines diet quality, nutrient intake levels. So we'll show you two images at a time that we choose based on just a couple of questions so we know which part of the diet map to drop you into. And we ask you, which of these looks more like stuff you eat, A or B? And when you answer, we show you two more. Say, how about now? And we do for diet what the phoropter does for visual acuity. Takes us as much as 60 seconds. And we've got you. Then we right size it for you using the Mifflin-St. Jeor equation. And we can report out, Cathy, in about 60 seconds, your diet type, operationally defined, and we have a comprehensive array of diet types. Your diet quality, measured using the Healthy Eating Index 2015, the most robust measure of overall diet quality. Your food servings of every different type of food group, and approximate intake of 150 different nutrients. We can report this out to you in 60 seconds, and you get the answer immediately. As soon as you provide the information, it's digital. You click your mouse, and there's the answer on your screen. And obviously, we're talking about working with health coaches. The health coach gets that information, and we have a clinician dashboard which can provide all the details that the individual user may not need to get, including trends that track, what's happening in diet quality, what's happening in nutrient intake level. And there's more that the Diet ID platform does. So the company does more than just assess diet. We have an intervention, we have a goal setting function, and so forth. But the true innovation here is an entirely, and this is patented, by the way, it's a truly novel thing, a fundamentally new way to assess diet that's just incredibly fast, easy, user-friendly, and actually, believe it or not, fun.
It's perfect for a health coach because it's accurate, and truly because of the people that set this up, it does allow them to stay within the scope of practice because they're not the one making the diagnosis.
Exactly. Diagnosis or the prescription.
Right.
That's built into the app. which basically empowers the individual to choose their goal diet. Now, I think it would be perfectly fine to run that by your health coach and say, I'm choosing the Mediterranean diet. I'm choosing flexitarian. I'm choosing vegan, vegetarian. What do you think? Yeah, I think it's a great choice for you. I think commentary, dialogue, support, coaching on that choice makes perfect sense. But we've taken that burden off the coach. And to be clear, we empower the individual to optimize within whatever lane they choose. So, if they want to do low carb or paleo, there are good and bad ways to eat low carb and paleo. If they want to do low fat, there are good and bad ways to eat low fat. If they want to do fairly standard American or flexitarian diet, there are good and bad ways to do that. There are bad ways to eat vegan and good ways to eat vegan. We have all of these options and many more, along with all the ethnic diets. So it truly is personalized nutrition, but it empowers the individual to make the right choice based on their specific goals and their specific tastes. And then the health coach is there to support that. And it all begins with this novel approach to assessment, so you know where you're starting. And then, you think about something all of us use all the time, GPS. What are the inputs to GPS? Well, for your GPS in your car or your phone to help you, first it has to know where you are now. That's the onboarding. Find me in the world right now. Well, with diet, that is, what is my current dietary pattern? That's the assessment. The next thing it has to do is drop a pin into your destination. So you tell it where you want to go. Well, that's how Diet ID works. Essentially, we empower each end user to say, the kind of diet I've heard so much about is the Mediterranean diet. I really want to try that. Great. Okay, that's your destination. Now we'll pick what tier of quality is just right for you using images so you can look at it and say, yeah, that looks right. I can do that. Now we have a pin in your starting point. We have a pin in your destination. GPS then gets you there with a turn list. Well, Diet ID does the same. We map that personalized route from where you're starting to where you want to go, and we populate that with a sequence of incremental adjustments to your behavior and your diet that get doled out to you via email and text message every day. And each step of the way, I think there's the opportunity for the coach to be a confidant, a support, social accountability. I mean, all the great stuff that coaches do. I think that's a great and important enhancement. But the bedrock of this resides built into the Diet ID platform itself. So as you say, I think perfectly complementary. What matters most about diet is diet. Yes, nutrients matter, but if you get foods right, nutrients take care of themselves. You can't really have an optimal diet unless you've got a good balance of nutrients, because that's part of what defines an optimal diet. Michael Pollan put it so beautifully in 7 words: eat food, not too much, most of the plants. I mean, that is the basic theme, and all really high quality diets pretty much conform to that. So it's real food as opposed to junk masquerading as food. The not too much actually tends to take care of itself. A really important point for coaches: one of the many virtues of high quality foods, and of course you can't have a high quality diet if it isn't made up of high quality foods. One of the many virtues of wholesome high quality foods is that they fill us up on fewer calories. Really, really important, because otherwise, you'd have a constant choice between being overweight but satisfied, or satisfied with your weight but hungry all the time. Well, not if you can fill up the satisfaction on fewer calories by eating more wholesome food. And for those who don't know this literature well, I very much commend to you the work of Michael Moss, Pulitzer Prize-winning investigative journalist, author of Salt, Sugar, Fat, and book. Michael wrote a New York Times Magazine cover story excerpted from Salt, Sugar, Fat, entitled, so remember this, you just Google this, The Extraordinary Science of Addictive Junk Food. So all you really need to do is put into the Google search box, Moss addictive. And I tend to call this the Moss effect. It basically, major food companies hire teams of PhDs, give them functional MRI machines and marching orders to design food people can't stop eating till their arm gets tired from lifting it to their mouths. So, I mean, essentially a bonus to big company executives if they can design food that is, for all intents and purposes, addictive. But that's only possible when they're mucking around with the formulation of that food. You can't do that with a walnut. You can't do that with a blueberry. The closer you get to foods that are truly direct from nature, one-word ingredient lists, the less opportunity there is for the Moss effect. So essentially, high-quality diets shift you away from junk and highly processed food and move you in the direction of pure, wholesome food. Pure, wholesome food in a balanced assembly reliably takes care of your nutrient needs for the most part. And obviously, if you're strictly vegan, you're going to need to supplement B12. Many of us need to supplement vitamin D because that's not really a nutrient. It's a hormone we're supposed to make from sun exposure, and most of us don't get enough sun exposure to make optimal levels of vitamin D. Many of us need supplemental omega-3 because we're not eating that much fatty fish, and on it goes. So each of the reasons for select supplements could be a whole conversation. But the bottom line is, Kathy, the focus really is on the overall dietary pattern and quality. I would say nutrients are secondary. I think we really should, in public health nutrition and in clinical medicine and in health coaching, be focusing on overall dietary pattern and quality. And then secondarily, nutrients. But absolutely, yes, nutrients may matter. And if I'm coaching somebody who has hypertension, I do want them paying attention to sodium and probably also paying attention to calcium, magnesium, potassium. But frankly, those things matter in cardiovascular health in general. They matter to some extent in diabetes management. Fiber is important for diabetes management, but also relates to blood pressure. Again, the best way to get all the nutrients right is to focus on the dietary pattern and quality. So Diet ID does both. And it provides information to the health coach at whatever level of granularity they want. Our clinician dashboard can be populated, again, with up to 150 nutrients. And in addition to showing you what the nutrient intake levels are now associated with the dietary pattern today, we actually show you the delta at the nutrient level between here's your client's current diet. Here's their goal diet, which they've identified using the app. Here's the difference. Here's the difference in fiber intake between where they are and where they want to be, and calcium intake between where they are and where they want to be, saturated fat, unsaturated fat, omega-3 fat, all the minerals, all the vitamins, macronutrients, calories. And we do the same for foods. Here's the difference in servings of vegetables, fruits, whole grains, beans, lentils, nuts, seeds, et cetera, et cetera. So, that's extremely empowering for the individual who now has perfect clarity on what they need to change. And again, the Diet ID platform delivers these changes to them incrementally. So it's a very gradual process, like a GPS turn list. You don't just teleport yourself to your destination. You get there one step at a time. Same with dietary change. But all the same information is available to the coach. So you can essentially align your coaching with the particular things your client is working on at a given time. And we've done the hard part of that. So the coach essentially is liberated to do that thing that coaches do so well, uniquely well. And that is the human touch, the support, the troubleshooting. That, an app is obviously somewhat rigid. It's running on algorithms. Humans are more adaptable than that. I think that's the beautiful synergy of this opportunity.
For coaches who help clients in their weight loss journeys, how can Diet ID help?
Well, again, I sort of answered that in part by talking about the incredible contribution to the nation's weight problem of highly processed foods that are engineered to maximize the calories it takes to feel full. So this has actually been in the literature many times. It was a 4-part expose in the Chicago Tribune back in 2005, 2006. I don't know if anybody read that but me. It should have been a national scandal, reading that our food supply is willfully engineered to be addictive. Somehow it wasn't. But then Michael Moss wrote about it again almost 10 years afterwards, and it's made a bigger splash now. But frankly, leaving aside the fact that I'm a nutrition expert and public health physician, and I'm speaking to health coaches, let's just think of all of ourselves as people, parents, some of us grandparents. Frankly, just on that basis, we should all be outraged. The food supply is willfully engineered to be addictive and contribute to epidemic obesity, diabetes, including in children, in order to fatten corporate coffers. That's really unconscionable. Everybody should be outraged about it. But outraged or not, it's the truth. And consequently, if we want to fix obesity in an individual, let alone at the population level, it's what we need to overcome. But the good news is this, again, Michael hasn't given me permission to call this the Moss effect, but I do that. The means of reverse engineering the Moss effect are simple. Just trade up the quality of your foods. As you move to foods with shorter ingredient lists, more wholesome foods, populating a more wholesome diet, you leave behind the opportunity for this corporate mischief. Again, there's no way to engineer addictiveness into an almond. if it hasn't been processed. I mean, if it's a honey roasted almond, it's another story. But again, the closer you eat to nature, the less this opportunity. So all of the high quality diets and diet ID, and again, diet ID is designed to be agnostic in the sense that if we could create 10 tiers of quality for this kind of diet, we did. And it wasn't always possible, by the way. We felt obligated to deal with keto because it's popular and we're being realistic about what people in the world are eating. We could not get 10 tiers of quality for keto. You can't create a top quality version of keto. It doesn't exist. You're either in ketosis and you don't have a balanced top quality diet, or you have a balanced top quality diet and you're no longer in ketosis. We tried. Our dietitians are very expert at this. They could not create a top tier version of keto. But for almost all the diets that are popular in the real world and realistic, you can create all these tiers of quality. And what that means is as you move up to the high quality version of any given diet, whether it's, Mediterranean, flexitarian, vegetarian, vegan, something else, ethnic, not ethnic, you're moving away from highly processed foods. There are sort of two key trends that represent the shift to higher quality foods. One is inevitably a greater emphasis on plant foods because that's where all the evidence says we derive the greatest health benefit. So more vegetables, fruits, whole grains, beans, lentils, nuts, and seeds. And we also accommodate, by the way, dietary restrictions, allergies, gluten-free, and so forth. So this is just assuming that there aren't any particular restrictions. If there are any, those are accommodated. So one shift would be a greater emphasis on whole plant foods. And another shift would be an emphasis on real food as opposed to junk masquerading as food. So less processing, essentially using the NOVA classification of ultra processing. For those of you who don't know, we now have a formal measure of how highly processed the food is. And the really bad actors are UPFs or ultra processed foods. And the scale used to enumerate that is the NOVA classification developed by Carlos Monteiro and colleagues. Carlos is a professor at the University of Sao Paulo in Brazil. So we rely on that as well. So the two key shifts you see are greater emphasis on whole plant foods and a shift away from ultra processed food. Well, as a result, you're leaving behind all of that willful mischief that increase the calories it takes to feel full. And what you're doing is decreasing the calories it takes to feel full. And that's a beautiful thing because it means you can initiate the success of weight loss without being hungry all the time. The other thing that we built in, Cathy, to this incremental approach to diet change is a concept. I coined this term many years ago. I think it was originally in one of my U.S. News and World Report columns, taste bud rehab. I've long claimed, and I have 30 years of clinical experience, so I went through this many times with patients. Taste buds are adaptable little fellas. When they can't be with the foods they're used to loving, they can learn to love the foods they're with. And that's very disadvantageous when we've got major companies selling us junk where food ought to be because we all learn to like junk.
Right.
It's very advantageous when you flip it around and take people in the other direction because as you start to make incremental improvements in your diet, and this has been proved many times, that one of the earliest studies to show this decisively was the Iowa Women's Health Study, which was a breast cancer study, but essentially shifting women to higher quality foods and diets. They actually developed aversions to the junk food they liked at the start and preference for the more wholesome food that they were growing familiar with. Familiarity is a very potent driver of taste preference. So if you cultivate familiarity with more wholesome food, you learn to prefer it. So my argument about long-lasting weight control is don't diet, live it. Diet is a fine noun, as in dietary pattern. It's a really bad verb. I'm going to diet. And I oppose that philosophy. What you really want to do is you want to live it. You want to make dietary changes that aren't just about losing weight, but about finding health. Basically, building the best version of you, your vitality, your best energy. Healthy people have more fun. That's what it's all about. So you want to love the food you're eating, but you also want to love the health and the weight that the food you're eating lets you have. And the way you do that is to align your dietary goals with your personal preferences and your specific objectives and get there incrementally. So you little by little acclimate and your taste buds go through rehab and you prefer less sugar and you prefer less salt and you no longer like the taste of junk and you actually learn to prefer more and more and more wholesome foods. That's a very common experience. And if you do that in a way where you're relying, yes, you're controlling portions and so forth, and everything in the diet ID experience is right-sized, But mostly what you're doing is giving up a lot of calories you didn't need because you're now filling up on fewer calories. And you're no longer being manipulated for the sake of corporate profit. You are more in charge of your own weight and your own health. And this is a formula for long-lasting weight management, not just weight loss in the short term. Any diet can produce weight loss in the short term. It's making it stick that's hard. You all know this. Well, the way to make it stick is if you're not spending the rest of your life hungry and miserable, but actually loving food that loves you back.
This sounds like the perfect tool for health coaches. How would we get a hold of it?
Well, now I guess now you're asking a business relationship question, and I've got a whole team to help you out with that. And first of all, thank you for that comment. I agree. We see health coaches as really the perfect partner. Again, I think in the modern age and with the pandemic having accelerated the shift to telehealth, there's a lot that can be done with digital assets now, and we ought to take full advantage. But there's nothing like interacting with a person. And we really love the synergy of doing all that we can do well digitally and then enhancing that with a human connection. So personally, I'm a very strong fan of aligning the best digital assets with health coaching. That's exactly the model I like. So anybody interested in pursuing this, let's just go right to the source, dietid.com. And you can connect directly. We have a wealth of information on the website about what we do, but also direct opportunity to connect to our head of partnership. We've got all the various models that we use to do business. We have quite a few contracts with individual health coaches as well as health coaching organizations. All that information is available. My team is extremely responsive. So essentially, if you just follow the obvious connections on the website and say you'd like a demo, you'd like a personal meeting, it'll be set up promptly, and we'll be delighted to explore the relationship with you.
That's great. Thank you so much for being here with me today. We will put a link to that website below the podcast recording so everybody can reach out to you.
Excellent.
Good luck with it. Sounds like a perfect solution.
Thank you so much. I appreciate this opportunity, appreciate the kind words. And yeah, diet should be a vital sign, and now it can be a vital sign. I'm confident it will be a vital sign, but it will take a village to help people not just measure their dietary intake, but manage it. And I think coaches can play a critical role in empowering people to manage their dietary pattern in the context of life's many demands. So this is a really important connection for us, and appreciate the opportunity to address all of you.
Great. Thank you so much.
Take good care.
Thanks for listening to the show. If you liked what you heard, please give us a 5-star rating or review on iTunes.